Hello and welcome to the factors influencing drug absorption. Drug absorption is the first step of drug pharmacokinetics, and we said absorption is that movement of the drug from the site where it has been administered to the bloodstream. So, what are these factors that are influencing that process? Number one is the route of administration. So, you find that different routes of drug administration, such as oral, intramuscular, transdermal, can significantly impact drug administration in that the drug bioavailability is affected. And when you say the drug bioavailability is the fraction of the administered drug that reaches the systemic circulation, okay? And it is very affected in oral administration. So intravenous administration allows drugs to directly enter the bloodstream, leading to rapid and complete absorption. A good example is when administering morphine. Okay, we normally administer it intravenous so that we can have quick relief of pain. Okay, great. Another factor is solubility. And in solubility, we're saying that drug molecules must be soluble in the body fluids at the site of absorption for it to be effectively absorbed. So remember, drugs can be lipid soluble or water soluble. So water soluble drugs are well absorbed along the GIT, while the lipid soluble drugs can easily cross cell membranes and be absorbed through other routes. Okay, so lipophilic drugs, okay, such as diazepam. You know diazepam, the one that is used to control convulsions. Okay, it's soluble in fats, so it's well absorbed in the fatty tissues. On the other hand, we have hydrophilic drugs. Okay, though hydrophilic, those drugs that love water or water soluble. Good examples could be certain antibiotics like penicillins. These ones are normally well absorbed in aqueous solution. Okay, so you'll find them in aqueous solution. That's where they will be absorbed better. The third factor is drug formulation. Okay, so the formulation, it could either be a tablet, yeah, like the paracetamol tablets, or amoxicillin capsules, or suspensions, or solution. They interfere the rate and the extent of absorption. So this one will affect disintegration, yeah, dissolution, stability, which can quickly and completely affect the drug being released and being absorbed. So we have good examples like extended release formulations. Okay, so this one, they'll be absorbed at a slow but sustained. Okay, as opposed to the tablets, okay, which will be disintegrated completely and be absorbed and the drug is over. Okay, next factor is drug interactions. On drug interaction, you're saying that certain drugs can interact with each other, okay, so that they can enhance or inhibit their very absorptions. So some drugs may compete for the same transporters, leading to the altered absorption. And this concept you're going to apply when you'll be looking at drug pharmacodynamics, where we are going to look at the inhibition, okay, and the synergies. Okay, yes. Next is fast pass metabolism, guys. So when the drugs are normally taken orally, they have to undergo fast pass metabolism in the liver before reaching the systemic circulation. That's why here the concept of drug bioavailability is highly discussed here, because it's thoroughly affected by that process. So drugs like propranolol, when taken orally, they undergo significant fast-pass metabolism, reducing their bioavailability. In contrast, intravenous administration bypasses the liver and avoids fast-pass metabolism. We also have the food or the drink intake. Okay, so taking drugs with food or specific beverage can influence the absorption. Some drugs are better absorbed when taken with food, while others may be reduced absorption due to the interaction of food. Like the tetracycline, you always avoid milk because tetracycline and milk are going to undergo the food drug complications. Okay, so when you have the food drug interactions, it affects the absorption of tetracycline. Okay, so food intake can affect drug absorption. We also have some drugs like levothyroxine, the one that is used for thyroid hormone replacement in hypothyroidism. Yeah, in hypothyroidism, this one is supposed to be taken on an empty stomach to enhance its absorption. On the contrast, we have drugs like certain antibiotics like amoxicillin. It's neither affected by food, okay, with or without food, that there's no effect for that case. We also have the pH and ionization. So drugs exist in different forms, ionized or non-ionized, depending on the pH of the surrounding environment. So the pH of the GIT or other absorption site can affect the drug's ionization state, influencing their ability to pass through membranes and be absorbed. We have examples like acidic drugs like aspirin. Okay, this one they normally better absorbed in the acidic environment of the stomach as opposed to basic drugs like morphine. Morphine is better absorbed in alkaline environment of the small intestines. We have the surface area and the blood supply. So absorption is enhanced in areas with a large surface area, such as the small intestines, where there is numerous microvilli to increase contact with the drug. So a rich blood supply to the absorption site also facilitates rapid drug uptake. So drugs require adequate blood flow to reach the absorption site efficiently. For example, subcutaneous injections of insulin, they need proper blood flow to ensure timely and consistent absorption. So absorption is facilitated in areas with a large surface area and abundant blood supply. We have sublingual administration of drugs. This is the best example to demonstrate blood supply. So we have drugs like nitroglycerin, yeah, the one that is normally used in myocardial infarctions, okay? So this normally put under the tongue, okay, and this is normally takes advantage of the rich blood supply and the thin mucous membrane leading to rapid absorption. We have also the drug characteristics, and you're saying that the characteristics of a drug can influence its absorption. So we have drugs like, for example, that are made up of large molecules, yeah, like aspirin, not aspirin, but insulin, yeah, or heparin. This one, heparin that is normally used as an anticoagulant. They have poor oral absorption and are typically administered through injections. One of the reasons why also insulin is administered subcutaneous and not oral is because of its characteristics. It's made up of large molecules and they may not be absorbed. Okay, great. The last one is gastric emptying and motility. And the rate of gastric emptying can impact the time it takes for the orally administered drugs to move from the stomach to the small intestines where most absorption occurs. So drugs that rely on rapid gastric emptying, like the aldrandate used for osteoporosis treatments, will require a patient to take them first thing in the morning, okay, on an empty stomach and remain upright for proper absorption. Okay, so guys, some of the commonest factors that influence drug absorption. Guys, you can access my free quiz just to test your understanding on drug absorption. Find the link in the description section of this video. Thank you and have a nice time.